Welcome to How to Go Independent, a podcast about helping advisors look at different business model options for their practice. Today I'm going to talk about a very emotional topic for some of us, and that is health insurance. It is a big stumbling block in some people's minds as they consider the options. I think for some people it stops us dead in our tracks, and many times that may be necessary, but in other times it might not be. So you'll hear me in a minute on a little bit of a monologue talking about the ins and outs of the basics of health insurance and how it might be different as an independent advisor compared to being an employee. I started with very little knowledge about health insurance when I started in the business at age 26. Wife that worked, no children. So we each had our own plan, and it was fairly cost effective. We didn't have a big need for health insurance or health care at the time. And as time goes on, as for most of us, we get older, we at least have potentially more need for it. So I've become much more knowledgeable between having two children and exploring the options, both in moving between employee firms and going independent. And I've had both my kids, one was born on a wirehouse plan and the other was born since I've been independent. So those were big expenses or potential big expenses that helped me dive even more into the details. So I think it's important if you're considering your options, you want to make sure you look at this, as it tends to be one of the bigger expenses. And you can refer back to my blog post or my podcast episode about payout. This is a big item right after staffing and potential office space. Again, it's very emotional, and I think as you look at the options, make sure that you look at the numbers, and then, it might be emotional thinking of the what ifs, but try to set that aside and certainly factor in the risk, but try to do it in the most objective manner possible, which is not always easy, but that's why it's sometimes to get a second or third or fourth opinion from other advisors you trust or other resources that you find helpful. One note about this talk you'll hear in a second. As I recorded it, my intent at the time was not necessarily to broadcast it. So again, the audio quality, as in last episode, may not be as good as I hope to have in the future, but hopefully you'll still find it useful. Stick around at the end and I'll give you a free resource that you can take advantage of that might help you in your comparisons. Kind of a thank you for listening through to the end of the episode. If you're really considering your options, I think you'll find it valuable. Here we go. Today, I'd like to talk about a topic that is very important, expensive, and emotional for many people, and has a big impact on some of the decisions that you might make around going independent or not. And that topic is health insurance. As we know, there's been a lot of changes in the last 5 or 6 years about health insurance in the United States. It's been a big policy topic of discussion and gets a lot of attention, a lot of emotion around the politics of health insurance. So a lot of factors at play. And I think it's a question that many people have as they're looking to go from an employee advisor to an independent advisor, or at least considering the option. So let me first say that I think it's very important and critical, and I don't think I would ever advocate that someone go without health insurance. Even if you're single, healthy, and young, I think the need for some sort of at least catastrophic plan is still there. So unlike life insurance that you might be able to do without in that scenario, I think having some health insurance, regardless of your situation, is critical. So let me go on record there. Starting the second point, like I said, it's expensive, so there's no way around that. But I think I'll give you some detail beyond that. But it's going to be a big cost. For most advisors, at least that are solo, going to strike out on their own, after staffing and office space, it's at least number 3. And for some of us, it might be number 2 or number 1, since you can do without staff or office space if you want to or need to. But like I said, I don't think you can do without health insurance. So with that as setting the stage, here's the good news and the bad news. The bad news I've already touched on. Health insurance is expensive, and it's still expensive as an independent advisor. The good news, if you will, is that it's not that much more expensive as an independent versus an employee, or rather, really, it's not any more expensive at all. However, let me qualify that. The insurance itself, the cost is not determined whether or not you're independent or not. What changes is who is paying those costs. So that's something we'll dive into a little bit, and it's much like your office space or your assistant. Those costs are there, and just because you don't write the check does not mean you don't incur them. And that's, that concept, that principle is one of the major reasons that you see a huge payout difference between the top gross payout number as an independent advisor versus what you see as an employee, because your employer is doing the math for you, telling they'll take care of everything, and they're paying your assistant and your office space and your payroll taxes and your health insurance, or at least a part of it, and they're giving you theoretically what's left over. But as I would argue, they're doing the math for you at a steep cost. So they're taking their profit margin on top of that. So the point there is that the cost of insurance is high and has been going up for many years, both for independent advisors and employee advisors. The only difference is who is paying the cost. But the main point is working as an employee does not make the insurance cheaper. It just kind of obfuscates or hides the cost from you as an employee. But as you probably have experienced, those costs, the employers have been less and less willing to cover those costs as they get hit with the increases over the last however many years. So the first option I want to touch on as you look at the options of going independent versus remaining as an employee is one, you want to make sure you look at what you're actually paying. And again, I pull out the numbers, look at your policy in terms of what it covers and doesn't cover. That's a big issue. That you want to be comparing apples to apples. But let's make the assumption that you decide you want to consider going independent. One of the big things that you may not be aware of, and I wasn't until I made the leap, made the change, was the availability of COBRA, which is essentially continuation of benefits is what the COB stands for. I think RA is Reconciliation Act, but basically you can continue your existing policy exactly as it is, but you will then incur the full cost versus having probably a subsidy that you may have as through your employer. Now, your employer may not be subsidizing it at all, in which case you can continue the same policy with the same cost, but that's something to consider because there's some flexibility around that is helpful. First thing is that you know what you have, and you know what if you're using certain doctors or other providers, you can continue those without question for up to 18 months. That's how long you can use the COBRA. At least that's my understanding. You want to make sure you confirm all this depending on when you listen to this information, as the laws obviously change. I found out about the idea of COBRA after I left, or I hadn't really considered it. When I looked at the options, it actually made sense for me to use it. So I ended up using my employer's, my big wirehouse firm's policy for another 18 months, which is kind of a nice, unexpected benefit, a surprise that I didn't know would be there. So again, one of the reasons I'm putting out this information, and these are the kinds of things I would have liked to know that were available or I had looked at. It was lucky for me that it worked out, but something to look at. So COBRA is a potential option to look at, and something I didn't find out until after I was already off COBRA is in most employee policies, you can't sign up your spouse or your kids without you signing up. In the COBRA option, at least last I was familiar with this, you can sign up only certain members of the family. So if you think you're fairly healthy and you can do with your own individual plan that's maybe just covers catastrophic, if something really bad happens to you, but you have someone else that needs the more robust coverage at lower cost or lower deductibles, etc., you could have a husband, wife, kids stay on the existing policy through COBRA. So that you can mix and match essentially is a really nice benefit of COBRA. So that's something to consider and look at. You have about, I believe it's 30 days to make that decision after you leave. But that's something you'll want to consider as you're looking at the different options on how to be covered when you make a change. The next piece I wanted to touch on are the different components of the cost of health insurance. I found that when I was an employee, I didn't really understand this stuff because, one, I was younger. Two, I didn't have kids until I was about 2.5 years before I went independent. So, that wasn't an issue. My wife is fairly healthy. She is also on her own policy as a teacher, so that didn't come into play. We had fairly nominal cost as employees because we were each on our own policy, so didn't really pay attention. So this is all things I've learned in comparing as I went independent and as we changed policies. As I record this, it's been a little over 6 years that I've come to learn more about health insurance. So different components are really important to think through, especially as you get to the point where I'd recommend you run the numbers and you really analyze the different outcomes, because the emotional part of this, I think, is a big deal. So I'll come back to that and tell a little story about my experience before I could get my wife's blessing to strike out on my own. The emotions in her situation were a big deal, and I want to make sure I honor that. So components of cost. The first and most obvious that we a lot of times will focus on is the premium or the monthly cost. So that's basically what does it cost you month to month to have that policy in place, and that's a fixed cost. And that comes out of your paycheck, or you pay the premium, just like any insurance, whether you have a claim or not. So like I've been fairly healthy, or at least let's put it this way, I haven't had a lot of health insurance claims. I won't say I'm super healthy, but I have not had a lot of claims, almost none. And I've been paying for health insurance since, in this case, for 6 years without any benefit from it. I just pay the money. Excuse me. And if I get hurt or if I get very ill, very sick, that's why I have it. And I have it for peace of mind for both me and my family. So the premium is fixed. And so as you analyze the numbers in terms of your potential total costs versus what you're paying now, this is the one fixed known amount. So you look at what are you paying, what could you pay on various policies, and what do you pay now? So that's easy to compare apples to apples. It's guaranteed to spend the money. One of the next big variables is the deductible. So just like with any other insurance, you have a deductible where your insurance, the insurance company doesn't kick in yet. Now, many of the old school policies, as an employee, particularly a generation or two ago, there was no deductible, and maybe there are still some now, but in other words, from $1, your company was picking up the cost of, you went to the doctor for allergies, and they paid the $87, whatever it cost for that. So the deductible, as you probably know, being in our business, the higher the deductible, the less that premium is going to be. So I have tended to run the numbers many, many times and always felt like the highest deductible I could get was probably going to be the most beneficial, because I want to be in a position financially, and with being independent, it makes it a lot easier from an income standpoint to be able to cover a deductible if I need it, if something really bad happens, but that drives the fixed monthly cost down. So to give you an example, I have a plan right now with a $10,000 deductible. So that's quite steep. Like I said before, it basically only covers me if I come with some terrible disease, or I'm in a terrible accident, or something very bad happens to me or to someone in my family. But the idea is I can cover that, and I hope I don't have to, but if something like that happens, that $10,000 will be the least of my problems. It'll be the health of me and my family that's the real issue. So the deductible is a big lever in moving the cost of the monthly fixed costs up and down. So even with that high deductible, like I said, health insurance is expensive. It still runs me, and it has run me for 6 years now, somewhere between $500 and $600 a month for a family of four, or at least for 4 years of those 6. I've had 2 kiddos. My son's 4 now. So we're talking $6,000 to $7,000 a year for the privilege of paying more money if someone gets really sick. Again, it's expensive, in case I didn't mention that, but it's important. So the deductible is a big variable, and again, you can get, if you don't like the idea of having these costs spike if you have if someone gets sick, then you can pay more per month. But my feeling, and I've done the math, is you're guaranteed to have that money go out the door. So over time, with a average, even probably below average health situation, you're better off, I think, with a lower premium, higher deductible. Because again, the difference in the deductible or the premium every month, if you set that aside, escrowed it for yourself, you would have the money to pay the deductible if and when something happens. But that's a financial planning technique that you can use if you like. But I think that makes the most sense. The next big component of cost or definition is something called coinsurance. So coinsurance is a percentage of the costs after the deductible that you then pay. Basically, it's a cost sharing. So it's, if I hit my deductible now the insurance company is starting to pay. They may not pay 100% depending on the situation. Another way they keep their costs down and manage their risk is they might have, a common one is 20%. So I pay, I believe that's my policy, I pay 20% of the cost after the deductible. So what that means is I'm still on the hook, but instead of paying 100% of the cost, I'm down to 20% of the cost. So again, health insurance is expensive. But that's something to look at, because if that number goes higher, obviously you're on the hook for more after the deductible. So you can, again, play with these numbers and kind of think of, what's the worst case scenario. And then, I like to assume that, because you don't want to have insurance but still have a health event, put you out of business, so to speak, because if that's going to happen, you might as well not pay the monthly insurance. In other words, go without it, and if you have something happen that puts you out of business, you need to make sure that if you have insurance, a health event does not destroy your family finances forever. Might be a hit, but again, you'll see around other information, hopefully you've picked up from me or elsewhere, that your net income is going to be dramatically higher. So that's after all these costs we're talking about. So keep that in perspective. So that's coinsurance. And then the last key component is the max out-of-pocket cost. And so what that means is, after all is said and done, the coinsurance, deductible, et cetera, what's the max that you're going to get hit with? Basically, capture liability. So I think of it, it's also sometimes called a stop loss, just like we would use when we're talking about a trade, a stock, or an ETF. That helps to make sure that you have a number that you cannot go above in terms of your cost in a given year. When I'm trying to illustrate, what's the financial impact of a really bad health event or events, I think including the max out-of-pocket cost is key, because that says what's the worst thing going to happen financially. And that's how I would illustrate things when you're determining not only what is the financial impact, but then how does that compare to where you are as an employee. So one thing I left out in this illustration was the copays, and that's because it doesn't add up to much from a dollar perspective. It may be annoying to have to pay $30 or $60 or $200 for various things, but in the big scheme of things, that's pocket change compared to what you will make more as an independent. So if that's the only consideration or the biggest problem, then that's a great problem to have. But I don't think copays move the needle enough to warrant a lot of in-depth discussion. So that's kind of the big components of cost as you look at different policies and try to compare apples to apples. And again, if you don't feel like you understand those terms very well, that's okay. I think most of us don't. If it doesn't affect us, that we have no reason to really learn about it. And that was certainly the case for me until I started having a direct need and reason to look at it. I was fairly ignorant on those topics. So let's do the numbers a little bit from a kind of a hypothetical standpoint. Again, I'm not a health insurance expert, and I'm not an attorney, and these numbers are not necessarily representative. Past performance is no guarantee of future results, etc. Your results may vary. Don't do this at home. All the disclaimers that you can think of, insert here. But let's say I'm paying, let's call it $7,000 a year in annual premiums right now, which is probably a little high, but for round numbers, that makes sense. And let's say for whatever reason, I have another $10,000 in a given year of expenses, which I don't. Might have been close to that the year we had our son in 2011, and I was independent at that point. But I knew that was coming and had prepared, so I knew that was a quote unquote once in a lifetime expense. But let's say I have $10,000 a year of costs, which I don't generally, and most people don't, even with all those considerations. You just, even if you have to pay out of pocket, an MRI is $1,400. We did that this year. I mean, it's no fun to pay that, but it just doesn't add up fast. And unless you're, again, having really bad things happen, really complex things happen, and you learn to price shop more than the average person when you have these kinds of things, or at least ask what things cost to make the decisions. But let's say I have $10,000 a year in expenses. That's $17,000 a year in health insurance related expenses. I would guess that you may pay just as much or somewhere close, but let's assume that you have a really good policy through a big firm, and let's say that would only cost you half as much. I'm going to guess that's a fairly accurate representation, but let's say you only pay $8,500 a year in health insurance expenses that come out of your paycheck. Well, $8,500 a year, that's a lot of dollars, but divide that by your gross production and think of that as a payout differential. And I'm guessing if you compare that percentage differential to the difference between your gross payout as an independent versus what you're getting as an employee, the starting differential should be at least 40%. So again, you can control what you spend if you're starting at a 40% difference. And if you have to give up, let's say you're doing $300,000 in production, that's 3% or less difference. So again, it's definitely a cost. I don't want to minimize it. However, in relation to the difference in gross income before expenses, it's a very small piece. Now again, you have a lot of other pieces that have to come out of that 40% differential: office space, employees, marketing, paper, printer, toner, etc. But I have other information you can find on those topics, or we can discuss it. But bottom line is, health insurance by itself, I don't think is going to make or break the change for most of us. Even if hypothetically, let's say for some reason you had a policy where you had no out-of-pocket cost for premiums or deductibles or copays, which I'm not aware of any such plan for a true advisor where you have your own book, have your own practice. But let's say you paid nothing. So that $17,000 is all incremental cost. Well, again, divide that by your gross production and figure out what percentage of your payout would that eat up in that scenario. Again, for me right now, let's be about 4%. So do the math for yourself. You certainly want to at least see what the damage could be, depending on the different policies you look at. And I can give you some resources or point you to some places to start to compare numbers. But I'm using this $17,000 a year as sort of it would be a bad year, not the worst case scenario, but it'd be pretty bad probably from a health and a financial standpoint. And it just doesn't move the needle from a payout difference enough, I think, to be the thing that stops you from making a change. So that's kind of the overall message. It takes some time and effort to analyze and see what the cost might be, but you got to run the numbers and try to do them. I haven't touched on the emotional impact. Try to run it without the emotional impact of these numbers. If you're paying a big deductible, are attached with something bad happening. Like I said, the perspective I'm trying to take in case something bad happens is the money's the least of my worries. Certainly, I want to know what the impact financially would be. And that's why I don't go without insurance, because if you didn't care about the money, you would just probably go without it, which again could probably ends badly, for too many people. So that's not a good solution. I had said I would mention this story. When I was looking closely at going independent, I was ready to do it in the summer of 2009. I was preparing. My wife got nervous. We had a 2-year-old at the time, and we had plan to have, at least one more child, which we did. But, she was hung up on that. Her dad had worked for the United Way for 35 years. She was a teacher. She was used to the employee model of the world, and it was a big deal for her. So I actually we had a friend of ours in the neighborhood that she knew well, who I asked to come over and talk about it, because she and her husband had their own business and had for several years, and they were pregnant with their second, I believe. And she came over to the house one night and kind of talked about basically communicated the message that you can still go to the doctor. You're not going to go bankrupt from not having some big company's health insurance plan. So that was very helpful. She was still nervous, but she trusted that between her friend and me doing the homework, we had kind of covered it. But the idea of being on your own and not have this big company behind you with health insurance was a concern. And what I've learned about it is the insurance company, again, they're offering the same kind of coverage to everybody. It's just the big company gets a price break, because if there's 50,000 employees, they're going to get a better deal. That's the way it works. I've had a situation where one of my businesses, we've set up a group plan recently, and we get no break because there's only 10, 12 employees, no history, in terms of claims experience. So it's kind of interesting. There's really been no benefit compared to an individual plan, or almost none. So again, the emotions are a big deal, but when you're doing the analysis on, should you remain where you are or consider setting up your own practice, try to take the emotion out as much as you can. One option, some resources, at least two that I think would be useful. One is ehealthinsurance.com. E as in electronic. ehealthinsurance.com. That's where I've always looked for. That's where I got my policy. That's where I've always price shopped and made comparisons. The other big one is healthcare.gov. When I got my policy, that wasn't around yet, and I've compared and contrasted, and so far it's made sense to keep my existing plan. Really, you'll find if you look at those two websites or others, the pricing is going to be the same. The insurance companies are offering the same policies on the individual market. It doesn't matter if it's through healthcare.gov or through eHealth Insurance or direct. If you go directly to the insurance companies. Mine, for example, is through Golden Rule, which is a subsidiary or brand name of United Healthcare. So it's not a rinky-dink outfit. It's a very large company. It's different when you go to the pharmacy and they say that'll be $80 because, and they feel guilty, and you say, okay, no problem. You're going to pay a few extra bucks here and there. And that, again, if you're not used to that and that scares you, you really want to think through that and prepare your spouse if necessary. But the net benefit, I can tell you, is quite amazing from my perspective. Again, other information you want to look on howtogoindependent.com. You want to make sure it's going to work for you in other ways. But again, I don't think health insurance is a showstopper that might have been. With Obamacare now, you have pre-existing conditions that must be covered, and therefore you don't have the problem of not being able to get insurance. So that has been an improvement, where there could have been situations where people had to keep their employee insurance, not just because of cost, but access to insurance at all. So that's been a big deal. There's also cases where if someone's 64 years old and they can wait till they turn 65 and go on Medicare, that's probably a good option. So maybe I'll do a separate conversation on, when you should delay a move or not move, and what the considerations would be. Hope that answers a lot of the concerns and worries about health insurance. If you have any questions, let me know, and I'd be happy to answer them. Health insurance according to me. Hope you find that helpful, and if you haven't really explored the different pieces of how health insurance works, because you've been in the employee world, I hope you learned something you might not have been familiar with. I know I've picked up quite a bit, as I mentioned in the episode. So the main takeaway I would have for you is make sure you do your homework, be thorough, don't do anything rash. But also, don't let one big number, like a big deductible or a big potential out-of-pocket cost if something really bad happens to someone in your family, don't let that scare you away, because the numbers that you may be leaving on the table could be far bigger in terms of your net income. So make sure you look at that in context of the potential. And I know that's hard to do sometimes. It's an emotional topic, as I addressed, but I think it really behooves you to look closely and make sure you're looking at the numbers, and certainly consider the emotional side, but look at the numbers very closely and do your homework. Let me know if I can help. I would offer a kind of a free consultation if anyone wants to have someone take an independent look at the numbers and their assumptions they're building into any analysis as they consider if it's worth going independent, or at least considering it closely. I'd be happy to do that. Kind of pick your brain on what assumptions you use and go from there, and maybe help making sure you're getting a third-party objective look. If you have any questions, shoot us a note at howtogoindependent.com, and we'll see you on the next episode. Till then, have a great one.